actually worked. We started pushing. Little did I know that pushing was going to last for 3.5 hours. At the very end, I was so exhausted. I didn't think I could go anymore. And then they tell me that he is turned sideways and his shoulder is stuck. My best option was to do an episiotomy. I literally felt the whole thing. My husband turned away because he was like, I could not watch that. Right after that, his head popped out. Since he was stuck behind my pubic bone, they could not get the rest of him out. His cord was wrapped around his neck and clamped, so he was losing oxygen. The midwife ends up hitting the emergency button, and about 15 people rushed in all at once. One of the residents sticks both of his hands inside me, the most painful part of birth by far, and is just yanking, trying to get him out. I am in the most pain I've ever felt in my entire life. The epidural just might as well not have been there at this point. Finally, yank him out of me and immediately rush him to the NICU. Much shock. Like, I have no idea what is going on.
Let's talk about shoulder dystocias. So firstly, what is a shoulder dystocia? So a shoulder dystocia is quite rare. It happens in about 1% of deliveries. So in a typical delivery, the baby comes out head first. In this story, the baby's head had not been delivered yet, and it had taken a very long time. That, in the doctor's and the nurse's mind, should have gone, there's something going on here. So the baby was already having a hard time coming out. At this point, the nurses should say, I see something called a shoulder dystocia on the horizon. I will let you know if we get to that point, but this is what is going on. It is very, very normal to push for about 2 hours. 3.5 hours is very, very long time. Okay, so now what a shoulder dystocia is. So the baby's head has now been delivered, and now the widest part of the baby is the shoulder, and that is the last thing that you have to push out. But in a shoulder dystocia, here is your pubic bone, and that pubic bone is resting on top of that shoulder. So the baby's head is out, and once that baby's face hits air, there's a trigeminal nerve in their face that will tell their lungs to start breathing oxygen. But they are no longer getting oxygen through their umbilical cords. So during this time, they are not getting very much oxygen because they are in the birth canal, and the birth canal is the tightest spot, and they are not able to fully open their lungs like they should. So during the shoulder dystocia, they are not getting oxygen. They are not getting oxygen through the cord, and they are not getting oxygen through their lungs, which makes this a true emergency during birth. If that shoulder has not been freed within a certain amount of time, it can lead to death, brain damage, etc. There's a few different maneuvers that you can do for a shoulder dystocia. The first one being Mick Roberts maneuver. This is where the nurses will take your legs all the way back to your ears, and you will push as hard as you possibly can. The next thing they can do, if that is not working, is they can flip you onto your hands and knees. This can sometimes pop that shoulder free. If that is not working, they can do what is called an episiotomy, which is where they cut the perineum. Now you have to remember, this is a bone-on-bone issue, so it's not a tissue issue. That episiotomy is not going to pull that baby free. The episiotomy is done so that the provider has more room, so that they can go in and hopefully free that shoulder from the pubic bone. And if none of those work, this is the scariest part. They will take the baby and they will push the baby back inside and do a C-section. Most times this results in the baby's death. Shoulder dystocia is a true emergency. And there are risk factors to a shoulder dystocia, especially big babies. Either they're big on their own, or you have something called gestational diabetes. Unmanaged gestational diabetes can cause this more so. If you guys have any questions about shoulder dystocias, leave them in the comments.